Thank you very much, Rosemary. And of course, from that report, and we have live in the studio Dr. Samuel Adewale Premier. He's the president, Association of Resident Doctors, University of Abuja Teaching Hospital. Thank you very much for joining us on Saturday Discourse.
Thank you very much.
And we want to commend you for what you're doing to help humanity.
Thank you very much.
All right, let's look at the issue beforehand. Now, to begin, can you explain what the lenacapavir, that's technical for me, is to us?
Thank you very much. Lenacapavir. The popular name is Yes to Go.
Okay.
That's the marketing name, actually. So this is, a lot of people will say HIV vaccine. This is not a vaccine.
Okay.
It's just one of those preventive tools that you take when you are HIV negative.
Okay.
Because you must be tested and be sure you're negative before you can take this. So it's not a vaccine, because vaccine teaches your immune system, how to recognize harmful substance in the body, either bacteria, virus, as the case may be, and will help the immune system to react to it should in case there is another reinfection of such into the body system, unlike this.
All right, well, that's a good one. We're moving forward, if you ask me. So now, since the discovery of this injectable, lenacapavir now, and its approval by World Health Organization, have there been success recorded?
Well, this was just approved 2025, that's last year.
Okay.
And then Nigeria is one of the 9 African countries, in sub-Saharan Africa that adopted this. We are one of the early adopters of this. We just adopted it about 2 months ago. That is in the month of March. But from clinical trial, randomized clinical trial, there has been a lot of evidence-based evidence that about 99% prevention of this for those who have been participating in the clinical trial. So we are hopeful, because you don't just take a medication and allow the medication into the system. It must pass through some of those stages of clinical trial in which this has been passed. A lot of researches have been on for more than 20-something years before the FDA finally approved this. Of course, there was a particular one, that one is cabotegravir, that was approved in 2021. But of course, in advanced country, but this is like the novel that was just approved by the international partner WHO, and then we just adopted it in Nigeria, and we started distributing it over the last 2 months.
Okay, from the time you started distributing till this moment that we're speaking, if you compare this injectable now with the preventive measures we had of HIV, how can you place it side by side?
Well, the fact that we have this lens does not stop every other preventive measures we have on ground.
Okay.
E.g., for example, if you have a discordant couple, for example, which means maybe the husband is positive, the wife is negative, or the wife is negative, the husband is positive. Of course, we advocate that the people who are positive, once they are taking the antiretroviral, they have a viral suppression, it reduces the risk of the other couple getting infected. And then the use of condom and every other thing, that we put in place as a form of preventive measure, it does not stop it. Only that this is just like a game changer, as been said, like we are going to experience a lot of reduction in new cases, which is called the incidence of HIV/AIDS. So that is what this is all going to be. Totally, the preventive measure has now gone high the bar now compared to, when you have a lot of things put together, better than when you have just 1 or 2.
So if I may ask you now, who is this meant for? Is it people at high risk, or who is it meant for?
Well, this medication is meant for everybody,
okay,
especially those that are, I would call them high risk. Those that are high risk, such as, like I said, discordant couple, maybe the husband is positive, the wife is negative, they are still living together. Like I said, it is important we know that HIV is no longer a death sentence. Even before the advent of this or the approval of this medication, a lot of discordant couple, they've been having their children that are HIV negative once they are on their antiretroviral and they are taking it regularly. So they have sustained viral suppression. So they've been taking it, especially, like I said, discordant couple, healthcare workers, surgeons who are exposed directly to body fluid and blood, so they are also to are high risk. Then young adolescents, those who does this injection of substances, drug, abuse and all of those. Then of course, in our clan, we don't have people, men who have sex with men. So those two, they are very at a very high risk. And then those who participated in anal sex too, they are high risk. So these are the group of people we group together as high risk. But ordinarily, if you work or you feel you are at high risk, working in an hospital, you have direct exposure to blood and all,